So I need a volunteer to come up here.
I've got a hand.
Ben has a head. Okay. So you can have the patient sitting at the edge of the plinth. They can be sitting on a chair, either one, however you want to do it. But they got to be sitting. Okay. No, you're fine. I am going to have you scooch to the edge here just a little bit, so I don't have to lean over. So our fulcrum. Well, the motion that we're measuring, and the way that we have our patient perform it so that we can measure it, is we want to include all of capital flexion and the rest of the cervical spine, or at least get some of it in there. Okay. So capital flexion is what motion?
Retraction.
Chin tuck or retraction. Okay. So the first thing we're going to have our patient do is a chin tuck, and then we're going to have them, the way that I give them the cue is look down your shirt. Okay? So they're doing a chin tuck, and then they're going to try and look down their own shirt. Okay? People get it. Like, oh, okay. Yeah. That's the motion we're going to be measuring, okay? So how do we line up our Goni? Our fulcrum for this motion is going to be your external auditory canal. Okay, or your external auditory meatus. That's another way to put it. I like to call it my ear hole. Okay, so you're going to line up that fulcrum with their ear hole, and then you're going to have the proximal arm, or the arm with the numbers, the lollipop arm, is going to be vertical. Okay, just straight up and down. And my movable arm, or my distal arm, is going to line up with right here. Does anybody know what that's called?
The mustache line.
The mustache line.
What was it?
Upper lip.
It starts with an N. The nares. That's called the nares, where your nose becomes hairs.
Yeah, nose hairs.
Nose hairs. It's the nares. Okay? So those are our points. Line up with his external auditory meatus and his ear hole. Straight up and down. And then I line this up. And notice how I'm not standing up here and trying to line it up, because that's going to change the outcome. I'm going to try and get lined up. So I'm looking straight at each one of his points. So each of his, yep, there you go. And then I want you to do that motion. So chin tuck and then look down your shirt. And he's got relax. He's got 38 degrees.
That made my arms hurt. Actually, these are tight.
Well, and your extensors or your suboccipital muscles are probably tight as well. I'm not a big fan of chin tucks, mainly because these muscles just are tight and they don't like it, and they're like, ah, stop it! And then I get a headache. Then I have to do suboccipital release on myself. That's hard.
So, are we supposed to be checking that their back is straight while they do that? Because would they not compensate by doing like?
Yeah, so you do want him to, and he did pretty good. He didn't move enough that I needed to worry about it. But yeah, you don't want him to do like this, right? Because a lot of times you tell your patients, like, flex your neck or bend your neck. They're going to be like, okay. And we don't want that motion because it is getting some of that thoracic spine in it. That's why we do the chin tuck and have them look down their shirt while they're keeping that proper posture. So we do want them to maintain that posture. Okay? Good call. So now extension. It's going to be the exact same places that we line up. So his ear hole, vertical, and then his nares. For extension, we don't want him to do a chin tuck because that'd be weird. It just doesn't work. Okay? We also don't want them to do this. Okay? So all we want to tell him is keep your proper posture and look straight up at the ceiling. There it is. Okay? So we'll get lined up again. And go ahead and do that motion. next, and he's got 30 degrees. And what's our normal?
50.
50. You might have been able. Let's see if you can go farther.
Okay.
Want to try it again?
Yes.
Okay. There you go. Get that proper posture. There we go. And go. Oh, that looks much better. Oh, much better. Yeah. Good. 46 degrees, so much closer to normal. Okay? Yes.
I bet you already said this, but are all of these active?
Yes, normally they are active. It'd be a little tough to like come in here and, not that it can't be done, but it can get a little tough.
Right, they just like let go.
But-
Yeah.